There's a tremendous movement for what we call Medicaid for All or Medicare for All. Which is it, Medicare? Yeah, Medicare for All. We have a state program called Medicaid, which is very similar. It's very confusing for Washingtonians. Medicare for All is our socialized healthcare model, or single payer as it's often referred to. A lot of people say we can't afford it. There are many examples of European countries doing it. Even Canada is doing it. But they don't have the same complex issues that we have. Really, a big part of it comes down to the way taxes work in the U.S. Every U.S. citizen pays very different taxes because they come from 50 different states.
So declaring healthcare a right, not a privilege kind of thing?
Declaring healthcare a right, not a privilege. Yeah, that's
what you mean by healthcare for all.
Well, that's what the Medicare for All movement is founded on, is that healthcare is a right. Started by Bernie Sanders. One can certainly see where he's coming from. It's easy for conservative America to disagree with that because...
Well, conservative America, they don't disagree on, wanting to take care of everyone. That sounds like a beautiful idea, but what people wonder is if you can afford it, if it bankrupts the country. But I'm sure everyone would like everyone to have access to healthcare and be healthy. It's just a question of if you can afford it.
Right.
Am I right or am I wrong?
Yeah, I would say you're right. Most people in the right wing want to take care of the underprivileged people in the U.S. that can't afford health care.
People are religious,
right.
I guess.
The issue is economical, of course. And so one part of the country is saying, no, this is going to cost us tons of money that is going to bankrupt our country 10 years from now. And the other side of the country is saying, no, it's actually going to save us money. Paul Ryan, former Speaker of the House, maybe still currently Speaker of the House, said it was going to cost us trillions more in debt within the next 5 years. I don't remember the exact line he used, but that's what the Republican Party is saying. And then the Democrats are saying, no, it's actually going to save us money. Actually, the Democratic Party isn't behind Medicare for All because still a very significant portion of it is corporate Democrat, which is, pretty right-wing, believe it or not. But that is quickly changing with the progressive movement in the Democratic Party. So who do we side with? That's a matter of opinion, but it's up to the federal government to solve this problem because they're the only ones that have the power to spend the federal money on healthcare. I will say that Bernie Sanders is currently the incumbent ranking member of the Senate Budget Committee. So a lot of people don't understand. They think that the president determines how the nation's money is spent. That's not true at all. Congress is the body responsible for managing the money and spending the money. And the Senate is obviously referred to as the upper house, has more power than the House. That's not really up for discussion. It's just the Senate is overpowered. And Bernie Sanders is, he's the leader of the committee that is most responsible for managing the budget. And most people don't know this about him. He has an impeccable record balancing budgets, and he's very good with money. Right-wing America is very threatened by Sanders and his ideas, obviously, because his ideas are so conflicting with theirs. But we can't deny his credentials or his role in the existing federal government, which is that he is the foremost member you could attribute right now to managing the nation's budget. So it's his projections and his plan. Medicare for All is his plan. And he's also the most qualified individual in our country when it comes to managing government budgets. That's why he's the ranking member in the Senate committee, while the Democrats have a minority in the Senate. So we still haven't decided whether or not we can afford it. Medicare for All is really the solution for a lot of our healthcare problems, but it's not going to fix everything, and it is astronomically expensive. But that's not because the idea of it is wrong. That's because the expenses are what is really the problem. The expenses, like hospital bills, are totally unregulated, and they're destroying our system. And people are extremely unhealthy, unprecedented levels of poor health.
Not
And
to mention they might get more unhealthy if there's healthcare for all, because then more people just get drugs and stuff prescribed to them, right?
yeah, he's saying that if we do have Medicare for all, then unhealthy people, which, you know, there's obvious links between lower income and poor health, just because of like the quality of foods you can afford. Those people will be put on medication, which will make them unhealthy, which I totally agree with. The root of the problem is the health of the workforce. It's extremely unhealthy. That's environmental, but it's mostly diet related. And I'm sure Kaylor and I totally agree on this subject. And that's why I think veganism is so important, because you don't need medication if you have a balanced plant-based diet. You just don't, unless you have some sort of rare condition. And you're not going to need to spend a lot on hospital bills, because you're not going to need surgery to remove dysfunctional organs or remove tumors that would never have taken root.
Then healthcare for all would be affordable.
Right.
And then we could actually do it, and there would be no debate.
The only thing that's keeping Medicare for all from being a reality is the expenses. And that's a problem that is very complicated. One is that healthcare is an industry, which should never be the case. It's a profiteering scam. And that's very much tied in with big pharma and the medications we're currently issuing sick people. But I think the bigger part of the equation is, why are we so unhealthy? What's causing that, and how do we fix it? If fewer people needed to go to the hospital, we wouldn't have to be so concerned about the budget. This is probably the biggest political issue of our age, and we've got to fix it. And the most direct way to address it is by addressing the underlying health problems. What's causing the sick people? That's what we should.
Wouldn't that be great? Because if we could address that, then conservatives would no longer mention the unaffordability of it.
Right.
Then you could afford it, and we could take care of everyone.